Good morning, and thank you for joining us this morning. I'm pleased, as always, to be joined by Dr. Lawrence Lowe, our Chief Medical Officer of Health here in Peel, Chief Darren Rizzi, from Mississauga Fire and Emergency Services, and Chris Giles, Manager of Compliance and Licensing Enforcement. Before I give my COVID update, I'd like to take this opportunity to congratulate Prime Minister Justin Trudeau and the Liberal Party on winning Monday night's federal election. This is a clear signal from Canadians that they support a progressive agenda as we work towards COVID recovery. I'd also like to congratulate Omar Al-Gabra, Ikra Khalid, Peter Fonseca, Sven Spengeman, Richie Valdez, and Ikwinder Gahir on winning their ridings here in Mississauga. Throughout the course of the election, we made our priorities very clear as to what the City of Mississauga needs from a federal government partner. This includes investments in housing, infrastructure, transit, including all-day two-way GO train service on the Milton line, and $10 a day childcare. And I'm very confident that our newly elected MPs will be strong advocates for us on Parliament Hill. I look forward to working closely with the federal government on continuing to build strong communities here in Mississauga. Thank you, all Mississaugans who cast their ballot, and to all the candidates for putting their names forward on the ballot. It's during times like these I'm truly reminded of how lucky we are to live in a country with free and democratic elections. And now for my COVID update. Yesterday, the province-wide vaccine certification came into effect, meaning that residents now have to show proof of their vaccination to get into some non-essential businesses, including gyms, cinemas, restaurants for indoor dining, nightclubs, sporting events, etc. The proof of vaccination program also means that residents will have to show proof of vaccination at some city-operated facilities to access certain services as well. These include sports and recreational fitness, with the exception of youth sports, meeting rooms, and city entertainment and cultural venues. City-operated facilities and programs that will not require proof of vaccination are rental space for day camps, childcare or social services, including parents picking up or dropping off their children, safety and social support programs, including warming and cooling stations, and Mississauga library locations. I want to remind all residents to please be patient and kind when businesses, organizations, or city staff ask to see your proof of vaccination. It was not their decision to implement this program. It was the Ontario government's, with support from the mayors right across the province, including myself. This program is meant to limit spread in settings where masking and social distancing isn't always possible. This program is in place to protect those who have chosen or are not able to be vaccinated, to protect our hospitals, and to help avoid the type of lockdowns that devastated businesses and residents over the past year and a half. So please, do not take your frustrations out on those asking you for your proof of vaccination. They're simply following the rules. For those who haven't yet printed out their second dose receipt or downloaded it on their phones, the easiest way to do so is by visiting covid19.ontariohealth.ca. It was very easy. I took the opportunity to do it myself yesterday and put it on my home screen of my phone. City of Mississauga libraries will be providing free printing services for those who don't have access to a printer at home. Residents will be able to access library computers using their library card or a free temporary pass to access the Government of Ontario's website and print off their proof of vaccination at no cost. If requested, and while maintaining privacy, library staff can also help residents log on to the provincial website to download their vaccination certificate. Your second dose receipt is what you will use to show your proof of vaccination until the province releases their enhanced digital certificate with a secure QR code on October 22nd. I want to once again remind everyone that businesses and organizations are responsible for verifying vaccine certificates by requiring people to show a piece of identification along with their vaccine receipt. A photo ID is not required. Acceptable documents to confirm identity include birth certificate, citizenship card, driver's license, government-issued ID cards, health cards, passports, and permanent resident cards. When a resident shows their vaccination certificate, businesses and organizations must verify the name and date of birth on the receipt, where the receipt was issued, that the individual is fully vaccinated, and that the date of the administration of the final shot was at least within the last 14 days. I want to assure all businesses that our bylaw team is ready to support you in interpreting the regulations and providing you with all the information you will need to ensure that you have a clear understanding of the province's vaccination certification program. Please do not hesitate to call 311 if you need support. As the Premier said yesterday, the proof of the vaccination program is a temporary measure, and I expect that it will only be in place until we are through the pandemic. COVID-19 cases across the province continue to show signs of stabilization. We are seeing the same thing here in Peel. Peel region is averaging 37 cases per 100,000, which is steady from last week. Mississauga is averaging 41 cases per 100,000, and that is also steady from last week. Our hospitals remain stable, with 29 COVID hospitalizations at Trillium Health Partners and 8 patients in the ICU. The situation is similar at Brampton's William Osler Hospital, with 16 COVID hospitalizations and 8 patients in the ICU. I'm very thankful that we have not seen a spike in case counts over the last few weeks. But I also know that we're not out of the woods yet. Kids just went back to school. And as the weather begins to cool, more and more people are going to be heading indoors to socialize. And this worries me, because while 78% of Peel residents 12 plus have received both doses of the vaccine, there are still roughly 300,000 eligible residents who are either only partially vaccinated or unvaccinated altogether, with little or no protection against the more transmissible Delta variant. That number is simply too high and puts many of our residents and the entire community at risk. We have to do everything we can to avoid the situation we were in earlier this year, or what we're seeing right now in Alberta, when hospitals became completely overwhelmed with COVID patients, and when surgeries and procedures were put on hold. And here's a reality that cannot be ignored. The vast majority of COVID hospitalizations across this province, across Mississauga and Peel region, are in individuals who are not fully vaccinated. This is proof that the vaccines are effective at limiting severe COVID symptoms. Peel Public Health is doing everything it can to make getting the vaccine easier through targeted outreach programs like the Vax Van, which is traveling to malls, cultural centres, places of worship, and parks throughout Peel region. So please, if you haven't received your first or your second dose, do so as soon as possible. It's the right thing to do. Join the close to 80% of us in Peel region who have already received 2 doses, members of your family, friends, and colleagues. The easiest way to find out information on pop-up and school clinics is by visiting Peel Region's website. Do it for yourself. Do it for the entire community. This is how you can truly help limit the impact of the 4th wave. And with new vaccine certification system now in place, getting the vaccine will also allow you to continue doing the things that are important to our mental and physical health as the weather gets colder, like going to a gym, like I like to do, or grabbing a bite to eat with a friend indoors at a restaurant. There's really never been more incentive to get the vaccination than right now. Before I ask Dr. Lowe to give his update, I just want to remind everyone that last week I kicked off the Mayor's citywide Thanksgiving food drive. This year's goal is to raise $400,000 and 200,000 pounds of food for the Mississauga Food Bank. The last year and a half have been incredibly challenging for everyone in our community, but in particular for the most vulnerable residents. And the need in our community has never been greater. Over the last year, the Mississauga Food Bank has seen a 14% increase in visits and a 58% increase in the amount of food that they distributed. So please, if you can, donate to this important initiative to help ensure that everyone in our community has access to healthy food year-round. The easiest way to donate is by visiting the mississaugafoodbank.org/Thanksgiving or by dropping off non-perishable food items to any Mississauga fire station. Thank you for your support. And now I invite Dr. Lowe up to give his update.
Thank you, Madam Mayor. Good morning. Mississauga's rate this week is 41 cases per 100,000, and test positivity is at 3.6%. With 78% of our population in Peel now vaccinated, I'm relieved that 1.1 million of our residents now have protection, two-dose protection, against COVID-19. This is a strong foundation for our efforts to control the Delta virus in our community. And with that, I'm also relieved at the launch of the provincial government's vaccination certification program yesterday to protect individuals in high-risk settings in our community. This temporary measure will help to reduce contacts and risks for our residents. They will do so by protecting those who haven't had the opportunity to receive 2 doses of vaccine in places where precautions can't consistently be followed. Please continue to be kind and understanding as everyone works to implement this program and keep our community safe. We're closely monitoring the impacts of school reopening on trends in our community and are also anticipating that cooler weather will start to take away the outdoors that we've come to rely on to make interactions safer. This all means that the best way to protect ourselves in the coming months is what we have been and must continue to do. Get 2 doses of vaccine, continue to limit contacts where possible by keeping gatherings small, outdoors, and virtual, and also continuing to mask and distance in indoor public spaces and in crowds outdoors. Sadly, most of the patients that have been recently admitted to hospital and ICU have been people who, unfortunately, have not received 2 doses of vaccine. Let me be clear that if you are not vaccinated and if you have never had COVID-19 infection before, this virus is as new to you today as it was in January 2020. Even having had COVID before is not a guarantee. There's no telling how your body will react if you're infected. But what we do know is that getting vaccinated with 2 doses of vaccine dramatically reduces your risk of death and hospitalization. That also reduces risk for all of us by ensuring that you won't end up in hospital, because hospital capacity is finite. We saw this in the 3rd wave, where Peel hospitals were transferring patients all over Ontario for life-saving care. It's what's happening right now in Alberta, in northern British Columbia, in Alaska, and in Idaho. COVID patients are being transferred all across Canada for care. In Alberta, as we saw in our own 3rd wave, non-COVID patients are also seeing their healthcare impacted, life-saving surgeries and treatments canceled and postponed. These impacts to healthcare impact all of us, not only those with COVID-19, because it means that the care we need just isn't there when we need it. Worse still, a colleague in another centre hours away was telling me just the other day that in the midst of the 3rd wave here in Ontario, some of the patients with COVID-19 that were transferred there from Peel never made it home. That news was sobering for me, and I certainly offer my thoughts to families who have suffered through this terrible loss. So as we move towards flu season and COVID in the fall, I ask you, please don't take the chance. Don't become part of a 4th wave of hospitalizations. get your shots, and stick to the precautions and see this through to the finish line. You can visit peelregion.ca/COVID-19 vaccine to find a clinic that you can book at or walk in. We have people that are on site ready to get you answers and get you your shots. Thank you for doing your part to stay safe, and I'll pass it back to Mayor Crombie.
Thank you for your update, Dr. Lowe. And now, along with Dr. Lowe, Chief Rizzi, and Chris Giles, we welcome your questions from the media.
Mayor Crombie, your first question comes from Steve Cornwall at the Mississauga News. Go ahead, Steve.
Welcome, Steve.
Good morning, Mayor Crombie. How are you?
I'm so well. How about you?
I'm okay. I think my first question is actually for Dr. Lowe.
Sure, no problem.
Okay.
I'll invite him up.
Good morning, Dr. Lowe.
Good morning, Steve. Go ahead with your question.
I wanted to ask you about kind of if there's been any changes in vaccination rates in Peel. I've seen in other jurisdictions that they've reportedly gone up with the introduction of these proof of immunization plans. Has there been anything noticeable in Peel that since kind of the plan is for immunization proof has been announced?
Yeah, absolutely, Steve. We do know that the proof of immunization has incentivized individuals to get vaccines. I think one of the things that I'm most heartened by is through our mobile clinics, we're seeing that many of those individuals who are coming out to mobile clinics are individuals who are getting their first dose. And that's certainly a relief because they are accessing this important protection. I had the opportunity, for example, to be at one of those mobile clinics and chat with a number of the clients that were there, and they indicated that they hadn't had the opportunity, they hadn't had the time. So the mobile clinics are a way of getting closer to individuals, making it easier to get their vaccine. And a lot of the current policies really support the idea of protecting all of us ultimately in terms of preserving healthcare capacity, but also protecting and encouraging individuals to get 2 doses of vaccine to prevent severe illness and death. So thanks so much for the question.
My follow-up is actually for you as well, Dr. Lowe. Just curious if Peel Health had any specific targets in mind for how a proof of immunization plan kind of might spike vaccination rates in the area, and if so, are we kind of approaching that target?
So our targets remain aligned with what the Ontario Science Table and our Chief Medical Officer of Health have identified. You're pushing towards 85, 90% 2-dose coverage. We've seen in countries such as Malta, in Denmark, in Portugal, in Spain, where they've reached those levels, that the bite of COVID-19 is significantly diminished. Denmark, for example, has gotten to a point where they are able to treat it as an endemic disease. So the longer we stay away from those targets, the longer we're essentially prolonging what we have to deal with in terms of trying to save lives and keep our hospital and healthcare system safe. So it really is up to all of us to try to be exposed to this virus one way or the other. The safest and easiest way to do that is through 2 doses of vaccine. However, at some point, we will reach a level in the community where we've had enough people infected, enough people immunized, that at that point we will have brought this into some form of endemicity and control. How quickly we get there is really up to us, how quickly we vaccinate. Thanks so much for the question.
Next question, please.
Your next question comes from Pooja Luthra at Y Media. Go ahead, Pooja.
Yeah, hi. Good morning, Mayor. How are you?
Good morning, Pooja. I'm so well. How about you?
Yeah, I'm good. Thanks. Mayor, I would like to first of all know, what do you have to say about growing rate of crimes in Peel region?
Yes, I understand there were 2 homicides in Peel region last evening, and I know that the police are investigating, so that's really all I can say at this time. I hope to learn more in the days and weeks to come.
Okay, and also I would like to know that, don't you think that the proof of vaccination should have been implemented everywhere instead of, only at high-risk settings? Because I guess it's creating a lot of confusion among people regarding the places where they need to show the proof of vaccine or where they can't. So what do you have to say on that?
Well, as you know, Pooja, that wasn't my decision. It was the decision by the Ontario government, the Premier, who decided that it would only be in high-risk settings where COVID is easily transmissible and where people can't safely social distance. So places of non-essential business, sports settings, concerts, indoor dining, etc. So in places of high risk, that was selected as where you would have to show your proof of COVID vaccine. But as you and I both know, many essential businesses have had to operate throughout the pandemic, yet many employers are also asking their employees to be vaccinated and have implemented their own vaccine policies.
Your next question comes from Khalid Salama at My Second Home TV. Go ahead, Khalid.
Welcome, Khalid.
Welcome. Good morning. And first of all, congratulations for the Red Liberals in Mississauga. Mayor Crombie, I know that Pooja just touched on this a moment ago, but the communities are talking about increased influence about gangs and drugs. And I know that you have some information, you are looking after that. What can you share with us today?
You're quite right. There's been an increase in gang activity and gang violence right across the region, not isolated here in Peel by any means. And I know this is where a lot of our police resources have been allocated. We remain one of the safest communities throughout Canada statistically, but I know people are upset when they hear that there has been an incident of homicide, and in fact there were 2 yesterday. So it gives us all pause for concern. I do support Peel Regional Police, and I know that they do an outstanding job and have a very, very high success rate at solving crime. So I'm quite confident that this was isolated and targeted and likely perhaps gang-related, but I shouldn't speculate, and they will investigate and give us more information in the days to weeks to come.
Very well, thank you. And the other question is, yesterday it was announced in Windsor that a certain number of staff who are not fully vaccinated will be put on leave without pay. How many we have here, and what is the situation in our hospitals?
So the number of staff in hospitals that are not vaccinated, is that the question? Khalid, I don't have that information. Dr. Lowe is shaking his head. He does not have that information. We can ask, but I would assume that the rate of unvaccinated would be very, very low, given that they work in in the hospital and have to face COVID-19 virus each and every day. So I don't know that exact number. We can call around and find out for you, but I would expect almost 100% vaccination rates in our hospitals. And I believe it is required, isn't it? Is it required? Dr. Lowe is going to address this. We believe it is required among frontline healthcare workers.
Thank you.
Thank you, Madam Mayor. No, so Khalid, we don't have that specific number. I'd encourage you to reach out to Trillium specifically just to see if that's information that they'd be willing to disclose. However, the Chief Medical Officer of Health for Ontario, his Directive 6 does require healthcare workers to get vaccinated or to undergo regular testing up until, I believe, it's October 13th, at which point there will be other additional a revisiting of the testing component of that. So as I understand it, all hospitals are moving to implement Directive 6, and some, for example, in the case that you've described in Windsor, have actually gone further to make it mandatory in respect of their employment. Ultimately, I think the key message is really that everyone should be trying to get 2 doses of vaccine. It helps to protect the individual against severe illness and death, and it helps to protect all of us ultimately by preserving healthcare capacity, helping to reduce transmission, and also really keeping keeping vulnerable people in our community safe. So thanks so much for the question.
Next question, please.
Those are all the questions today, Mayor Crombie.
Great. Thank you for joining us.